Good morning, everybody. I'm here with Dr. Elmer today. Our last conversation was quite a emotional one, but that just goes to show you the passion that Dr. Elmer has. Today, we are going to discuss traumatic brain injury, which he's probably giddy inside over here because it's one of his favorite topics. I myself know a few people that has suffered a traumatic brain injury. I tagged a few of them on here that I know personally that have had a traumatic brain injury. One of the first questions I want to ask Dr. Elmer is exactly what is a traumatic brain injury? What does that mean?
Well, it's an effect on the brain that was obviously introduced by a trauma, and therefore it caused the brain to have acceleration and deceleration effects, caused it to slap against different parts of the skull. Some of those parts of the skull are very unforgiving. They have sharp edges, even though they're covered with a coating called the dura. It still can have a very harsh effect as the brain bounces around, pinballs around inside that skull. It can have a disaster effect. That's why people are always asking me, can't they do something with the helmet in football? My comment is no.
No.
It's not the head, it's what's inside of the head that's the problem.
Because it gets shaken around like jelly.
Exactly. And it is more like jelly. In fact, I've got video footage of a fresh brain. And when you look at that fresh brain, it literally sits in a bowl and it assumes the shape of the bowl. And you pull it out, and this certain individual that's holding it, he's trying to be very careful not to harm it. And the corpus callosum, which connects the two sides, is literally tearing. Even though he's so careful, it's still tearing. That's how fragile this thing is, like a big thing of jello or tofu, and it's easily harmed. The biggest issues that happen in a brain injury are usually the blood flow disruption, because the capillary system is already set up to supply those nerves what they need, so that when they function, they increase the blood flow, and they've already got established efficiency of that blood flow. Well, when we disrupt all of that, now that blood flow doesn't work. Now I can't get the garbage out. It's kind of like trying to do a reconstruction job and the roads are out, right?
Yeah.
And I can't get good stuff in. I can't get bad stuff out. And that's the more difficult part of the healing process, is getting the bad stuff out. And so that's disrupted. Another thing that doesn't normally get checked in a TBI, I mean, I'm dealing with a TBI injury right now that was fairly recent, and they went through all the basic checks that they always like to go through, and it always relates to the brain. Say, well, there are other things that can get injured in a TBI, particularly the brain stem itself. And
makes perfect sense.
Yeah, especially because the brain is suspended by a thing called the tentorial membrane. The tentorial membrane is kind of like tents that are suspending it where it's supposed to be. And as you go back and forth, it stretches the brain stem, and it can get kinked on the tentorial membrane. When that happens, it can have a radical impact on the brain stem itself. And that's why I start with, when I do an analysis on a brain injury, I'm looking at the brain stem first. See, if something happens to that, it's like we're trying to do reconstruction here in Las Vegas in several different areas, and the spaghetti bowl is out. Whoa, we can't get anywhere now because everything has to go through it. If anything is coming from above and going down, everything goes through it except for sense of smell. Everything coming up has to go through that brainstem. And so if there's a problem with that brainstem, in fact, here's a larger version. This is the medulla here. This is the pons here. And this is the mesencephalon or midbrain. And the midbrain becomes the brain. It's like cauliflower, right? We got this stalk that becomes the budding, which we call the cortex. Well, it's the same thing with the pons. The pons and the cerebellum are one. They're not two separate things. There are 8 nuclei on each side, and they contribute the budding that we call the cerebellum. So it's a one piece, and it's got its own individual blood supply at each level, and that's why when we tend to think of stroke, but you can create stroke-like problems with trauma. Slap somebody and you've seen an instant bruise, right?
Mm-hmm.
That's a disruption of the blood flow. You ruptured a blood vessel, right? Well, imagine if you hit it, and because it's a long tube of muscle, you create a spasm
Mm-hmm.
of it. Okay?
Mm-hmm.
That's one possibility. So it shuts down the blood flow to that area. That acts like a stroke. It comes back, right? The blood flow comes back, but for that period of time, it didn't have blood flow. There's also a thing called blood
What
hemorrhage.
happens when there's no blood flow? What is it dead in anything, or
It starts to die, and minutes make a difference,
so?
like any stroke.
Okay, so that's when it comes to a stroke. So whenever somebody has a traumatic brain injury, what is, I mean, other than in the hospital, right? They're in the hospital, but what is the most important thing after they get out of the hospital start working on or their family, because they might not even know what to do because they have a traumatic brain injury. So what would be the very first step?
Right off the bat, we're going to have to be concerned about putting the demand on that individual. What do I mean by that? If they're an athlete, they're out, right? I'm sorry, you can't play for right now. Why? Because we're concerned about your future health of your brain.
Yeah.
Not just now. We want it to heal, but we want all those functions to come back if we can get them, right? There are some people who get injuries that are so bad that some of those things will never come back, even with very clever care. The effect of a brain injury on the individual, you have to see it as they need time to heal. They need time for their system not to be asked to do much, right?
Mm-hmm.
My schoolwork is now very light. I'm not going to, for the first 2 weeks, no physical activity.
Really?
They're going to be very relaxed and very calm. And then after the 2-week point, we're going to introduce aerobic activity, not patterning. We're not going to run patterns. We're not going to do specific drills that are going to demand something of the brain. We're going to be just doing things that are improving the oxygen in the system. Because when, like, let's say I take somebody off of work, the first thing they lose is aerobic capacity, right? You're used to working 8 hours and the certain demands during that time. When you go back to work, even if it's 2 weeks you're off, that 2 weeks, man, I'm tired.
Yeah.
That tired is aerobic capacity. It's already gone down. So we want to get them back into aerobic capacity for the next few weeks. And we want to progressively increase those capacities, but we're watching very carefully.
Yeah.
And that we're watching for sensitivities to light, sound, smells, taste. We're watching for any change in moods. If I were, which I never would, but if I were like a team doctor and somebody came off the sideline and say, okay, stop right here, and we're looking, and they get irritated at me, I say, get in the tent, and you're probably not going back in the game. Mm-hmm. and you may be out for a while, because when they can't control their emotions, I say, I understand you're excited about the game and you want to go win it, okay, but I need you to calm down or you're not going back in. If they can calm themselves down, that tells me something, right?
Yeah, that makes perfect sense.
If they can't, I'm sorry, you're out of the game, because it not only do I have an issue, but I could make it way worse.
Yeah.
Because I'm going to demand at a higher level, but also there's a thing called damage amplification. I do it in the martial arts where you hit the guy and you immediately follow with an exact hit in the same place.
Okay.
So I tore the tissue. Now I'm going to make it worse. It's like tearing an order to a cloth.
Yeah, right? Yeah. It's
very nice. I get goosebumps whenever I think about it. But the same concept. And once I have a brain injury, it doesn't take as much force, and it doesn't take the same vector. So I got to be really, really careful with that individual. Also, in all of this, if I demand more than the blood flow can now supply. Let's say I damaged a blood vessel in the head injury. Say, well, how would you do that? Well, we just explained that it could be spasmed, but also there's a thing called blood hammer, where that instantaneous whip in a car accident or in some kind of sports injury, it slams the blood against the blood vessel, which is almost, a slap in the face. It's just shock.
Yeah.
Well, it creates that shock inside the blood vessel wall, creating instantaneous inflammation in the blood vessel, which causes it to react with a spasm, right? I'm spasming up, and it causes inflammation on the blood vessel wall, which is one of the major reasons for plaquing in the first place, right? It becomes sticky, and cholesterol comes in to heal it, and it lays over it. But then if other stuff comes, it starts to, like calcium can come and plaque over that, and now we've got a future problem because I'm losing blood flow as a result. But I want to make sure that they have time to heal, that we're getting good fluids into them. Now the thing they tend to like to feed a brain injury right after. I'm not in that ball.
What does that mean, to feed a brain injury?
To feed a brain injury, give it good nutrition. Makes
Okay.
sense, right?
Yeah, it makes sense.
You got to give it good nutrition, and logically it seems good, but in all the research that is coming out now, it shows that a time of fasting to allow cells that are not going to come back to die. It's called autophagy. To allow the autophagy to take place, like let's say I have a patient fast. They'll do a 1 day fast, and I'll say, how do you feel? Actually, I feel a little more clear-headed. Cool, we're cleared out a little bit. Then we'll fast again, and I'll ask them, how did they do? Oh, even better. And then I'll have them fast again. How did that do? Didn't do anything different. Okay, we're done fasting.
Gotcha.
We're done fasting for right now. And we allowed for those cells that aren't coming back, because if we feed them, we'll keep them alive. Right. And they're not the kind of cells that we want functioning, because when they dysfunction, they're going to keep dysfunctioning.
Makes perfect sense. We
want to keep the ones that we can bring back and bring into full fruition of health and strength and plasticity. And so that's some more of the uncommon stuff that even most of the specialists don't know, unless they're keeping up with what the research is saying.
It's crucial. So when somebody has a traumatic brain injury and the brain swells, I know that's a very common thing, and I know it's very dangerous to have that happen. So when the brain is swelling, with the traumatic brain injury, is it cutting off blood supply?
Yes, it's cutting off. Not only when we think of blood supply, we're always thinking arteries or veins, right? And yes, that can happen. That's pretty drastic. That's pretty drastic blood flow to
swell?
Or swelling, to have it actually impact that. It's much more common to affect the capillary system, right? I got some pressure over here in the brain. I got some pressure over here in the brain, and it's not enough to cut off the arteries, but the capillaries themselves are getting choked. So if you think about the capillaries as being, the small roads that are into your community, right? And it's a lot easier to do something to those than it is the big roads, right?
Mm-hmm.
And when we cut that off, you cut off everybody in that neighborhood.
Yeah.
And so when you have that kind of swelling, it has a major impact on all that capillary system. Now, the capillaries are often injured themselves.
It would make sense in a traumatic brain injury.
Exactly.
Yeah.
And one of the things that we deal with is called a problem called diffuse axonal shear. We already know that when the brain gets rocketed inside a vehicle or whatever, and the skull goes back and forth, the brain goes at a different frequency, and so the head goes forward, and as it comes back, it's bashing into the frontal lobe. And then as it comes forward again, it's bashing into the occipital lobe here. We already understand that, but there are different frequencies within the brain itself, because we know that white matter is the cells, and it's more towards the outside on the cortex. And so the white matter is thicker. I mean, the gray matter, that has the cells, is thicker than the white matter, which is the axons or the extensions of it. So it resonates at a different frequency than the white matter. And so we can shear whole areas of white matter away from their cell bodies, the gray matter, the gray matter. And as that happens, we lose a whole area of the brain, of the activity of that part of the brain because of the diffuse axonal shear. Now, all of that is supplied by blood flow, right?
Yeah.
Capillaries. And so if you're shearing that, you are definitely shearing the little capillaries in there. And so they're having their own little brain bleeds inside of there. And so all of this, when you get that picture, and you're looking at your kid who just got pulled out of, football or soccer, that's the common one for girls is soccer. They tend to more easily get injured with a brain injury.
Really?
Yeah. And it's soccer that's the most common for them. Because they're doing a lot of headbutting and stuff, not just with the ball, but they wind up running into each other and and butting heads.
That's why saying "got it" is such a key thing. I've seen some pretty nasty head butts, and even in a baseball field. I mean, the pros.
Yeah,
it's dangerous.
Exactly. And then once you have it, now we got to start thinking long term, because the cells inside, those that we can bring back and get alive, we need to start slowly bringing them up to speed in their time, not in our time. As we bring them up to speed, they can do more, but we have to understand that area is very sensitive. It's very fragile. It doesn't take nearly as much trauma to create a reconcussion. It doesn't take oftentimes it won't even be a trauma.
Yeah, that movie Concussion is such a good movie. It really explains it very well. So whenever the brain, I know I've heard about this before. I've heard that doctors will put you in a coma sometimes with a brain injury. Mm-hmm. And is that because they just need the body? You just need it to settle down.
The body needs to settle down. The brain needs to settle down. It needs to focus on the healing. And that, because if it has to do too many things, it may just shut down. And so they induce the coma. Sometimes the brainstem itself will say, we have to shut down. And that's when they go into coma but that's not a bad idea. I mean, and drilling, opening up space for the brain to expand has saved a lot of lives.
Yeah, it's crazy.
Brilliant concept. Oh no, that's horrible. Oh no, you probably saved that person's life, because the expansion will choke that system and it will shut down. The reason we call it the cranial vault. The reason it's sitting in there is two major reasons. One, it's the most important.
Yeah.
Anything that happens to it screws up everything else. And number two, very fragile. So it's actually contained in a vault. That vault is completely closed off. Something happens to the vault, something happens to it inside the vault, disastrous. And so we want to make sure that they've got plenty of time for that expansion to come back down, to go through the healing process, to go through the effects of healing. The brain doesn't do well with swelling. Doesn't do well with inflammation, right? And I'm going to differentiate those two, because one is creating an enlargement of the tissue, right? Well, it is the inflammation that's doing that, right? But there are two effects, right? One is an expansion of the tissues, and the other concept is it's trying to heal everything in there. We need both. The problem is the pH changes and all that are disastrous on the brain. So we want to limit it to what it needs for the healing, and then we want off. We want to affect future swelling. The cells that do the healing in the brain are called glial cells. Those glial cells, just like we talked about before, plasticity, and that's the nerve cell learning. It's becoming more resilient to the stresses that are placed on it. Well, the glial cells learn. Once they go through inflammation, which they normally don't have to do, once they go through it, they go, oh, this is how it works. And so the next time, it's going to happen at a higher level, and then a higher level. Let's say I get a minor trauma and I get a even bigger effect. That's why. We don't call it plasticity, we call it priming, glial priming. The glial cells are now more adept at creating that inflammatory response. Let's say, like I had a patient he played for the Jets. He was a quarterback, and he had like a 4.3 40. I mean, so here's a running back who's also a quarterback, and he would take off. And what does that mean? When he'd take off, he was gone, but the collisions were amazing, right? And he had several very blatant injuries in this brain, looking at it on MRI. Whereas like on concussion, those were all microscopic. You had to look under the microscope to see the CTE. Well, with this, it was blatant ablative. We call it ablative lesions, right? Like a stroke, and it's got an area. You say, that's dead, right? That's ablative. Well,
and once it's dead, right?
The dead stuff is dead. It doesn't come back, right? But what I find in functional neurology is I don't know what else is affected, and I don't know the difference between dead and live until I start pushing it.
So when that section is dead, say there is a little section that's dead in the brain, does other parts of the brain compensate for that section?
They can.
Interesting.
They can, and you have to push it to do that. You can teach a person to see with their tongue.
Interesting.
Mount a camera, and they're already doing this. They mount a camera on their head, and then an electrode on their tongue is specifically designed to take and mimic the signal that's going to go back into the visual cortex, back in the occipital lobe. And that area that receives for the tongue goes into that, near that area, and then you force the person to look at that right through their tongue over and over again, and you can get them to the point where they can not only negotiate an obstacle course. Let's say they're going this obstacle course, and they can go around things, but let's say you have different numbers, they can tell you what the number is. So that's the number 3. Right? It's not just that they're learning the course. It's not like the echolocation people who will echo, which is really cool.
Yeah.
They're teaching their visual cortex to create a map, which is really cool. But we're talking about, we're now taking artificial means to take in the world, and we're translating it into a signal that's getting closer and closer to how we really signal in the occipital lobe, so that we can actually see it, and it's getting more and more clear, and they can negotiate, and they can tell, what's up there, which is really, really fun. But when we have a brain injury, we have to be really careful, because other things can trigger it. Other things can reconcuss the problem. And so I don't like Panda Express. My daughters love it. My wife
don't like it either.
Yeah.
It's like the McDonald's of fast food to me. That's all I'm just saying.
That's right. That's right.
Sorry, Panda.
Well, I was in Panda with my wife and daughters because they wanted to go, and it was my turn to order, and the lady said, "Well, can I help you?" And I said, "Yeah, I'd like a glass of MSG and a straw." And she said, "Oh, we don't have MSG in any of our products." And I think she said, "We don't put MSG in any of our products." I said, "Well, maybe you don't put it in, but it's in it." I said, "Because in about 15 minutes, my head's going to be cloudy, and I'm going to be mad."
Yeah.
Because I have some brain injuries, and it reconcusses me. MSG, monosodium glutamate. Glutamate is the most prevalent excitatory neurotransmitter in your brain.
Oh, so don't eat any glutamate.
Yeah, no glutamate.
Yeah. What else what would you find glutamate in?
Well, it's not just glutamate. Any of the artificial sweeteners could potentially have an impact on it. But we have to find what those things are. And the other issue is, if that's happening, I may have a blood-brain barrier problem too, which means other stuff may be getting across. But I want to avoid reconcussing at all costs. Why? Not just because it's bad today, but the glial cells are learning.
Yeah.
They're still learning. Oh my gosh, it just keeps getting worse. It just keeps getting worse. And so we want to work to stop those, to eliminate the triggers, especially while they're still triggering. And we want to close the blood-brain barrier so that most things won't get through and create that reconcussion. Stress can do it. Hormonal events can do it. April 15th, that time of the month, finals week, you go down this list, all of those things. Whenever a patient says, man, do I have a seriously cloudy head right now? Okay, that's where I'm looking right off the bat. And I'm giving them omega-3s with krill because I want to knock down the inflammation as quickly as I can.
Interesting, because I was going to ask you a question off camera today about a mutual friend of ours, but I'm going to ask it right here because it's kind of goes what you're talking to. So a mutual friend of ours had a heart attack, and he had 5 vessels replaced, and he is suffering now what is called soft cabbage syndrome. And the doctors are saying that because foggy brain, and they're saying because he was off on the heart lung machine for so long that so now he's about a month in, no, not even. No, he's about a month in recovery now, but he's still having foggy brain. So soft cabbage syndrome is what they call it. So it sounds kind of similar.
Yeah.
In a way.
Yeah, it sounds similar. And so, yeah, I want to make sure that he's getting an anti-inflammatory, and the way I would do that right off the bat is I would try something natural. And if that's not doing it, then have your medical doctor either anti-inflammatories or no inflammation, which is steroid. And I'm not the guy who's completely against all these things, particularly steroid and that. I'm for the wise use of them. If we're doing a level of anti-inflammatory and it's barely touching it, but it is having an impact, then let's try steroid. I don't have any problem with that. I'm not the guy who says that, but the patient will say, well, what do you think? I say, well, if my wife had this problem, I'd want to try the steroids.
Okay.
Because I want to get the inflammation down, because the current inflammation is the emergency.
Yeah.
We got to get it down. We can deal with the future in other ways, but we got to get that inflammation down now, because the brain doesn't like that. The pH changes cause their own damage and their own issues to it. Let's get that knocked down for right now, and then we'll do other things to make sure that doesn't continue.
So omega-3 and krill, would it help with that?
Well, omega-3s are natural and anti-inflammatory. Krill is an anti-inflammatory.
Really?
And all that, yeah. I've never had a patient who had like a adverse reaction yet. That's not to say it's not possible. In fact, I gave some to somebody, and I said, and then later I thought, oh, I wonder if she's allergic to fish or shellfish or anything. I didn't think about that in her case. And she came back and she was better. And I thought, I would watch for that reaction. But if you take an ibuprofen and you're feeling a little better, it's inflammatory.
Yeah, I'm a firm believer in that. As I've gone on my own course of life and just been learning about more healthier lifestyle, inflammation that's where the pain comes from. I would say, 90% of the time. I'm not a physician, but usually it's inflammation. And once you get the inflammation under control, you don't have to, it's a lot better.
Yeah.
I try not to take the ibuprofens. I try not to take any of that. Every once in a blue moon, I'll take one, but inflammation, that's where the pain comes from. When I was in college, I was explaining to Doc, I did a paper on TBI, and it was so interesting. That
was like 3 weeks ago.
Yeah, right. I know. And then I remember one of the things that I read, and this was, actually it wasn't too many years ago I went, because I went to college very late in life, almost when I was 40. So the 5 years, it says to average to really get recovered, it's about 5 years. Is that correct?
That is current information, right?
Okay.
And that's with their current procedures, current policies, and that, which is always frustrating to me when I look at that, because I'll have patients come in and the doctor said this, doctor, this is the best we can do. And I said, that's the best they can do, right? Nobody's pushing it. It's a lot like stroke, right? Which technically is a brain injury. It's not a traumatic brain injury, but it is a brain injury.
It makes perfect sense.
And they've got this stroke, and it's causing these problems. And with the current understanding, the current therapy model, at the end of a year, whatever you got is what you got. It's not going to get any better. That is not what the research says now. The research says, keep going. Keep going. You can continue to improve, continue to improve. Why did we stop at a year? We just gave up. We gave up. The insurance company quit paying, or whatever, but we gave up. And because we gave up, because everybody collectively gives up at that year mark, because everybody believes the doctor when he says what you get at the end of the year, that's what we have in our society. But then when you put it to the test of real legitimate research, they're finding, boy, these patients are continuing to improve. And we don't know where the end is.
Imagine that.
Yes, imagine that.
Imagine that.
If you keep trying,
You
if
get
at first
better.
you don't succeed, skydiving's probably not for you.
Probably not.
Right.
Well, it goes back to everything we've talked about every single week, and that is not only keep going, move it or lose
Push
it. Keep.
Yeah, keep
You know,
pushing.
I know what Dr. Elmer likes to say is, I don't even say this anymore, but one of the things that when I would say, I can't remember everything, and Dr. Elmer would say, it's a temporary retrieval problem.
Temporary retrieval.
So
problem.
as he's been saying that, and after I watched quite a few classes with him now, I don't say that anymore. It's just like I'm having a memory retrieval problem. So now it's funny how when you take that stand and how powerful the brain is, because my memory retrieval problem seems to be getting a little bit less.
Yeah.
And it's because I know that I'm trying to refire,
Yeah.
you know, other parts of my brain, and
Yeah.
we can do that every single day.
Yeah.
They just may be a little bit gaggly a little bit because we haven't used them in a while, like handwriting. You
Yeah.
know, that's a perfect thing. I was thinking about that the other day. I was handwriting, like literally writing on paper. And it's funny because when you first do it, it's like the same thing, right? You kind of lose it. That's so that I eat more and more. I've been trying to do a little bit more handwriting because the more I do it, the better I get at it,
Yeah.
which is the same thing with the memory retrieval problem.
Right.
You know, and in fighting insomnia, all those other things we talked about too, which I didn't realize you just popped up, Chad. So it is about training the brain, and Laura's here today to visit us. So what would you say after someone gets a brain injury and doc sends them home with the family, what would be the next best step you think for them to really try to improve their brain injury?
Well, getting the right kind of care
Yes.
with the right kind of viewpoint, because the current model, even the most advanced model, which is kind of laughable, you know, the NFL supposedly leads the way on this, and it's a joke. And Cleveland NFL and Cleveland Clinic. Oh, did I say their names out loud? Yes, I did. They're probably coming after me. I'll be waiting. Come get me. I'm not going anywhere, right? But they're the people who put those things in play. They're not the best in the world at what they do. They're the best at cocktail skills, right? They know other people. It's not who you know. It's how you know them and how they know you. And that's why they got the job. And these poor NFL players are paying the price for it, right? Cleveland Clinic is great at diagnosing. I'm not disputing that. But after that, fixing stuff, they're just like everybody else. They all read the same books. They all talk to each other. They have they're same experts who are saying the same thing. And then at some point they're saying, well, this is all we can do for you. And you're right. That's all you can do for them.
Yeah.
You need to see somebody who does something different, right? And so getting the kind of care that is going to allow you to progress that system, to find the places that need the help and focus on it. Because the current thought is most of the time it's a basic physical therapy approach, which means we're doing equal exercises both sides. We're doing exercises with glamour muscles, right?
Yeah.
The biceps instead of the triceps. We're doing anterior compartment stuff versus posterior compartment stuff, and it's the posterior compartment that is our adult brain. We're doing things equally side to side when one side needs the most effect. And because when you, like, let's say I'm working on one part of the brain, I'm working on the basal ganglia on the right, and I got a basal ganglia on the left. If I'm working the side on the left, it's inhibiting the side on the right. And if I'm working on this side over here, it's inhibiting. So I don't want to mess with this. I want to mess with the one that needs the help. And I want to listen to it. Well, how many exercises do we do? To fatigue. What's that? You'll know it when you see it, right?
Yeah.
You'll know it. They're blinking. They're I
Slouching.
love it. Doing this, and they're going.
Yeah.
Yeah, we're doing basic eye movement exercises and doing 1, 2, and they're going. That's it. That's fatigue. We're done. We can only do what the system can do. If you push it harder, those cells will die. And so, not too much, not too little, and in the right place. Finding that kind of practitioner is much more difficult. But finding it, you're looking at the ability to take that brain and optimize it. Sidney Crosby, the hockey player, who arguably one of the best in the world, Hall of Famer already. You know, he hasn't gotten it, but I mean, he should, he will. And he had a brain injury. He could barely walk, much less skate. He had to retire. He'd been to Harvard and a bunch of other places. Nobody can figure it out. Then he heard about Ted Carrick down in Atlanta. So he flies down to Atlanta, and since that point where he's working with him, you can go on the YouTube and put Sidney Crosby, Ted Carrick, and you'll see a video interview where they've got the team doctor and the coach and Sidney Crosby and Ted Carrick, and they're all talking, and they finally, the one doctor's trying to explain, you know, what happened to him, but Ted's explaining how he got him back on the ice. You know, who cares?
Chad would love that video right there. He's one of the people that just joined. He's a huge hockey fanatic. So what a great, that's awesome.
Yeah. And now he's won 2 Stanley Cups since then. Almost the year after that, won a third since that brain injury. I feel he's better than he was before, because we're not just putting that system back up to where it was. We often are optimizing that system, causing the brain to function more than it was before, to its optimal form. And
sounds like Dr. Carrick's an amazing physician.
Absolutely. You know,
I think I've heard you mention his name before. Yeah.
That's why we spend all the time, effort, and funds to study under that guy, because it's well worth it.
Wow. That's pretty amazing. So, Dr. Elmer, I'm going to let us we'll wrap up here. Is there anything else you want to say before we close today? Well, I want to say a couple things. Well, at least one thing. You know, there's a few of you that I know will log on to this video today that I know personally that has had a loved one suffer from a brain injury. One of them wasn't too long ago, and I have talked to Dr. Elmer several times about this young man. So if you do know someone that's had a traumatic brain injury and their doctor is saying that's the best we can do, that's the patient that Dr. Elmer wants. The ones that just everybody's given up on them. Dr. Elmer does classes on Wednesdays, and my husband's friend came to the class, and I had told him to come, and he comes to the class, and there was a gentleman here who had a stroke, and James said that he could barely speak, or speaking was not very well, and the doctor said that's the best we can do. Well, he had the man talking by the end of the video, but what I loved about what James said is, I love him for saying this. He goes, Dr. Elmer worked on the right person that day, and he didn't work on me. And that's okay, because he knew that man needed you more than he did that day. So we cannot end videos in tears anymore, Doc. So, but I do encourage you to really come to his classes on Wednesdays at 6:30. Dr. Elmer and I talked before the video. We're going to start, make sure that you all know when they are so that you can come. And they'll be on his business page. We're going to ramp that thing up and get it going. That's a great place to maybe within the classes, maybe post some questions, and Dr. Elmer can address them at the very beginning of the class. But I'm going to let Dr. Elmer have the final word today. And we appreciate you all joining us. Traumatic brain injury is serious business.
It is not something to dabble in or just play around with. And a lot of the experts are dabbling in it. They feel that they know what to do and how to do it. Following a specific protocol and procedure is absolutely necessary, not only for helping that person get back as close to full function as possible, but also making sure that their future isn't fraught with more and more difficulties as they go, more and more reconcussions, of that problem and that. And so if you have any more questions, come to the class. We'll draw out pathways for you, show what's going on. If you have a friend, bring them to the class. It's really fun to actually deal with a real situation with a real patient and to show the hypersensitivities of the light, and then do something and all of a sudden it's less sensitive to light or less sensitive to sound.
It's where the magic happens.
Yeah.
The magic happens in those classes, in all honesty. When I first met him, I met him in a class, but it was in a different environment. And then I went to a couple of classes here, and that truly is where the power of what he does. And I appreciate you, Dr. Elmer, very much. And I'm so glad that you joined us today. We don't know what our next topic is. We'll have to discuss that off camera. But I appreciate everybody joining us. And please come to Advanced Spinal Solutions on Flamingo. It's on Flamingo and Pecos. I don't know the exact address. What's the number here?
3505.
3505
East Flamingo, number 4.
3505 East Flamingo, number 4. He's right there, Flamingo and Eastern, right by that sign, the Jumpy House place with all the little strange
Amazing
stuff in it.
Clowns.
Amazing Clowns. He's right behind that. What a perfect
Which
place
is a
for a
metaphor.
doctor.
It's a metaphor for me.
Yes, it is.
The Amazing Clown Store.
So please, we hope you join us for our class, and we would love to see you. We'll be doing a video 2 weeks from today, which would be the 21st. So have a great day, everybody.
Bye.